Welcome to Breakthrough No Hype Health Podcast, the one that cuts through the noise to get the real story behind today's health system, innovations, and policies without the nonsense. I'm Dr. Chris Ho, a specialized skin cancer physician in Brisbane, Australia, and today we are tackling a topic that sparked global curiosity and controversy: the Aussie healthcare advantage, what the world can learn. Universal healthcare, bulk billing, no medical bankruptcies, free hospital care. Sounds like a dream, right? Well, for Australians, it's just everyday life. Compared to the chaos of the American system, Australia's Medicare model can look like a paradise. If you haven't, please listen and watch my video, The US Healthcare Excellence, the Best in the World, and more, to really see and feel the contrast, the gap between US and Australia healthcare systems. Today, we are diving into what Australia's healthcare system gets right, where it's striving, and what the rest of the world, especially the US, needs to pay attention to. The healthcare system that works. Let's start with the wins, because compared to the US, Australia's healthcare system is really in another league. Australia's healthcare rests on two pillars. One, Medicare, introduced in 1984, gives all citizens and permanent residents access to universal health coverage. Two, the PBS benefits scheme subsidizes the cost of essential medications. Here's what that means. 1. Universal coverage. Everyone gets care, GP visits, hospital treatment, basic diagnosis, it's covered, no matter what your income or insurance status is. 2. No medical bankruptcies. Never heard of it. However, in the US, medical bills are the leading cause of personal bankruptcy. In Australia, that's not even part of the conversation. If you get sick, you get care without financial ruin. 3. Bulk billing. This is where it gets really Australian. If your doctor bulk bills, they charge the government directly and you pay nothing out of pocket. Picture this: you walk into the doctor's office, you get checkup or treatment, and you walk out. No bill, no deductibles, no hidden fees. That's bulk billing, and it's especially common for GP visits and routine care. 4. Affordable medications. Thanks to the PBS, prescription medications don't cost your paycheck. Life-saving drugs stay accessible even if you're not rich. 5. Overall, better health. Australia has higher life expectancy, lower infant mortality, and better overall health indicators compared to the US. It's not magic. It's smart policy. And guess what? America is mad that our medicine is too cheap. They want to punish Australia for that. Yes, you heard right. The US, led by Donald Trump, is now slapping tariffs on Aussie pharmaceuticals. Why? Because apparently our medicine is too cheap. Trump's taking aim at CSL, our largest medical exporter, saying our government, the Australian government, is subsidizing cheap drugs through the PBS and undercutting American companies. He wants tariffs to bring pharma jobs back to the US. That is ridiculous and perverse. And what does Prime Minister Anthony Albanese say to that? The PBS is not for sale. Straight up, no apologies. He called it what it is: economic bullying, and pointed out that Australia runs a trade deficit with the US, not a surplus. We are trying to keep medications affordable for our people, and the Trump regime throws a tantrum because we won't let Big Pharma price gouge us. It is shameless, it is incredulous. Okay, let's not pretend that Australia is perfect. While Australia's system is far better than the Americas, it has its own cracks. Rural access, GP shortages, bulk billing is under strain. Reimbursement rates haven't kept up for decades. The NDIS. What is that? NDIS? A badly constructed scheme with very poor oversight. Yes, we'll tackle all that in the next episode. Where Australia's healthcare is cracking and what needs to happen next. If you found this helpful, if this episode gave you something to think about, or if you ever had to battle a healthcare bill in the US, share it, tell a friend, follow or subscribe to the channel here. And if you have 60 seconds, no, even 10 seconds, leave a review below. It helps us keep bringing thoughtful, grounded conversations on healthcare without the noise, without the hype, and certainly without the nonsense. I really appreciate it. It means a lot to me and helps support this new channel that strives for no nonsense, no hype information. This is Breakthrough No Hype Healthcare Podcast. I'm Dr. Chris Ho. See you next time.